Doctors are numb, but they are not aware of it. I will explain it in today's video. When you experience anything for the first time, like riding a roller coaster for the first time, going out with a girl for the first time, and playing the game on the laptop like GTA 5, and flying on the plane for the first time. Like when you feel any experience, any feeling for the first time, it is really different kind of experience. But when you repeat all these things daily, like flying frequently if you are a frequent flyer, or going out with your girlfriend on daily basis for a walk, or playing game if you have your own gaming PC or gaming laptop as I have. So these feelings will not be same as you felt for the first time. You kind of take all these things as like daily to do things. You will not feel as much emotions as you felt during your first time when you did all these things for the first time. So it really changes, and we all human beings adapt to our environment really fast. So same thing happens with the doctors when they first expose to the patients, like during their internship years or clinical postings. They do have all like excitement and fear, as many of medical students are scared from the blood. So they do have all the emotions like fear, joy, or excitement. But with the time, they adapt to their working environment. They see worst case scenarios during their duties, like on daily basis, like gunshot wounds or fracture, broken bones, and amputated legs during severe accidents. So they adapt to this lifestyle as like they progress in their career. In early days of the practice, doctors do think about patient's emotion or their like patient relative emotions, but with time and more exposure of the patients to the doctor, they just adapt to it, and they do not really care about patient's emotion. They treat and move on to the next patient because of the workload, patient burden. They do not care about the emotional state of the patients because they themselves do not have a good emotional state because of the workload, senior harassment, not getting enough sleep, or not getting leave for like family functions, sister's marriage. Sometimes this also happens because of the emergency cases or आपकी यूनिट की emergency है. All these problems are faced by the doctors. If you have any doctor friend and you told him or her like उसके पापा की यार फीमर फ्रैक्चर हो गया और उसके पापा को एमआई हुआ था, मायोकार्डियल इंफार्क्शन, then your doctor friend will ask like how he's feeling now, and then he or she will say like the patient will get better with the time. So they don't express their emotions that much. It is kind of their like daily task because they already gone through these phases a lot of time. They seen a lot of myocardial infarction patients or fractured bone patients. But for the family, they are experiencing it for the first time. It is not their job, so they are very scared and they irritate the doctors by asking the same question again and again because they are feeling this feeling. Oh wow, because they are feeling this feeling for the first time, and it is not like their work, and they don't see these kind of situation on daily basis as we doctors see. So with time, as doctors move upwards in their career, they lack express their emotions, and that is why I told you that doctors are numb because they saturated themselves by doing their duties. Doctors sacrifice a lot by choosing this noble profession. I'm sharing my example here. When I started my internship for the first time, I do really care about the patients. I asked them, how are you feeling? And I took more time with every patient, like taking blood or blood samples, not taking blood samples. After that, I asked them, how are you feeling? When senior doctors are going to discharge you. But with time and जैसी मेरी like medicine की posting आई, I thought like I need to do work fast because of the patient load. We have to measure the blood pressure for all the patients, like 60 to 70 patients, and after that we need to take the samples pre-round, and after that post-round work they gave us like किसी की राइल्स ट्यूब डालनी है और कैथेटर आउट करना है या सैंपल्स भिजवाने हैं. सो आई रियली लॉस्ट माई फीलिंग, दैट फीलिंग व्हेन आई thought more about the patients. After that, I started thinking about my work more than the patients. Like I need to finish this task. After that, move on to the next task. So it is not our fault also, because if we do take more time on every patient, then there are a lot of patients, and we will not be able to finish our task on time. So I think India needs more doctors so we can handle patients well. Now also we try our best to take care of the patients, but I don't know, it is not in our hand, and we adapt to the environment, as I told you, really fast. So emotionless state हो जाती है कभी कभी हमारी भी. We sacrificed a lot for this profession, like our peak youth years and 10 to 15 year of studies. After that also we do study for like new guidelines. So next time when you say like doctors are looting us, think before saying these words, like how many years he or she gave to this profession and how many nights these guys worked without sleeping. So please count all those sleepless nights and how many years he or she gave to this profession. Think before saying that like, doctors are looting us, because they gave a lot to this profession. But we doctors really enjoy and love our profession, and all the hard work pays off when some patient thanks us on their way to home after getting treatment from the hospital. So that is all for this video. Catch you guys in the next one. Take care. Bye bye. Peace.